So let me get this straight. Your RHS exam is a couple weeks away and you still don't know what to study? Bestie, this video is for you. What going on, DA fam? It's your girl Leela. Who else? And welcome back to
The DA Study Spot, yeah.
In today's video, we're covering the highest yield concepts for chapter 41 in the MDA 15th edition textbook, Intraoral Imaging. Now, this chapter can seem a little overwhelming, so today I'm going to break down the concepts you actually need to understand for your exam and in clinical practice. So grab your notebook and let's get started. But before you do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! Intraoral imaging refers to radiographs that are taken inside of a patient's mouth.
These images help the dentist diagnose dental caries, bone loss, periapical infections, impacted teeth, root abnormalities, and changes in surrounding bone.
Without quality radiographs, many dental conditions cannot be diagnosed during visual exam alone. So here are the 3 intraoral images you need to know.
First up, periapical images. Periapical radiographs show the entire tooth, the root, the apex, and the surrounding bone. These are used when the dentist needs to evaluate infections, abscesses, root fractures, or bone surrounding the tooth.
Memory hack. PA stands for picture all of the tooth.
Then we have Bitewing images. Bitewings show crown of upper and lower teeth, contact areas, and crestal bone. These are best for detecting interproximal decay and bone loss. If the question asks which image is best for cavities between teeth, the answer is Bitewing. Next, we have Occlusal images. Occlusal radiographs provide a larger view of either the maxilla or mandible. They are commonly used for impacted teeth, retained roots, salivary stones, and jaw fractures.
This is probably the most tested concept in radiography.
The paralleling technique. The paralleling technique is considered the preferred method. The image receptor is positioned parallel to the long axis of the tooth. The central ray is directed perpendicular to both the receptor and the tooth. Why is it preferred? Because it produces less distortion, greater accuracy, and more diagnostic images. The bisecting technique. Bisecting is used when paralleling isn't possible. Examples include a shallow palate, small mouth, or large tori. So instead of placing the receptor parallel, an imaginary bisector is created and the X ray beam is directed perpendicular to that imaginary line.
Memory hack. Parallel equals preferred, bisecting equals backup. Let's cover some of the areas the DANB loves to test.
Cone cut image. The appearance, a clear white area on the image. Cause, the PID was not centered over the image receptor. Overlapped contacts. Appearance, overlapped contacts. Cause, incorrect horizontal angulation. Foreshortened image. Appearance, the tooth appears too short. Cause, vertical angulation was too steep. Elongated image. Appearance, the tooth appears too long. Cause, vertical angulation was too flat. And a blurred image, which is usually caused by movement. So either the patient, receptor, or tube head moved during exposure. Memory hack. Steep equals short for foreshortened, flat equals long for elongated.
Chapter 41 also discusses modifying techniques for different patients.
Examples include children, patients with disabilities, patients with gag reflexes, and edentulous patients.
One helpful clinical tip is to start with anterior teeth first when you have a patient that has a gag reflex before moving to the posterior teeth. Another thing that I always found helpful for patients with dental anxiety is explaining to them what I, the dental assistant, will be doing. Hi, my name is Leela. I'm going to be taking a series of images of your teeth today. Some of them are going to be a little bit uncomfortable, but I'm going to do my best to get it done as soon as possible. I get right to the point and ask if they have a gag reflex. If they say yes, then you let them know you're going to start with the front teeth, which is most comfortable. Now let's do a quick review.
Question 1. Which technique is preferred? The paralleling technique. Good. Question 2. Which image shows the entire tooth? The answer, periapical. Amazing. Question 3. Which image is best for detecting interproximal decay? You got it, Bitewing. Question 4. What causes overlapped contacts? The answer, incorrect horizontal angulation. Last question. What causes a foreshortened image? Yes, excessive vertical angulation. I knew you would get that one correct.
All right, besties, that's it for today's study session, Chapter 41, Intraoral Imaging. If today's study session helped you understand Chapter 41, Intraoral Imaging better, don't forget to like and subscribe to the DA Study Spot. And if you haven't done so already, check out last week's study session, Chapters 38 through 40, RHS Essentials. Want to go beyond today's study session? Get your Ultimate DANB Certification Study Guide linked in my description box. High-yield concepts for all 3 exams, practice questions, cheat sheets, and so much more. Click that link in the description and then share with a DA bestie, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.